the overall reason why we do this is not because we want to leave the belly open, it's because we have to leave the belly open, because the clinical scenario dictates that. And so they need to have a clear understanding that it is better for a patient not to just push yourself through the operation and get it done because you have to do that, but to get the patient off the table safely and prevent postoperative complications, which could include abdominal compartment syndrome, continued sepsis, and so forth.
Originally, when we used this for trauma patients, we wanted to abbreviate our operation, resuscitate the patient in the ICU, and then be able to bring them back on another day to complete the operation when they were in a more physiologic, normal state. All those same variables still apply to the emergency general surgery patient, if not more so. We often take septic patients to the operating room, those that are actively getting blood, those that are on anticoagulants that can't be reversed, those that are on blood pressure medications that are vasoconstrictors. To perform a bowel anastomosis in these settings is not necessary anymore. We can abbreviate that operation, resuscitate the patient, and bring them back when they're healthier and complete that to get better results, rather than just doing it all in one situation and kind of hoping for the best.
The goal should be, in any situation, is to get a primary fascial closure and to get the midline closed at the same time. It's not a secondary goal, it should be one of your primary goals. The reason why primary fascial closure is important is because if you don't, the quality of life for that patient is just horrific. There are a number of studies that have shown that they're depressed, they can't work, they can't sleep. If you can't get their bellies closed, they're going to have a huge protein loss, which is only going to debilitate them and prevent them from getting better. That's number one. Number two, if you can't get their bellies closed and you just have to skin graft over it and they walk around developing these giant abdominal hernias, their lives are ruined. They can't sleep. They're in constant pain. They have gait disturbances where they're trying to compensate for their giant hernia, so they're always pulling back and always getting chronic abdominal pain. Digestively, they also have a problem. So the quality of life for people that are left open with their bellies open, like we used to do all the time because we never thought you can get a belly closed, are miserable. It's the best way to describe it.
I think most patients who have long-term open abdomens that were not able to get fascial closure never really make it back to work. I've seen some that have tried and they end up really going on disability, having problems. Nutritionally, it can become a problem. GI function can be affected. Chronic problems with constipation. I've seen in a lot of these patients. It's really kind of a miserable lifestyle. And obviously, it impacts not just them, but impacts their families, their ability to earn a living and so forth.
Non-closure of the abdomen for a patient is probably one of the most impactful issues that you'll run into with dealing with an open abdomen type problem. It basically adds about 12 months to that patient's care. They're going to be in doctor's offices, they're going to be coming back to the hospital. If they do a manual labor job, they're unlikely able to work. And it will take about a year for that inflammatory response and those adhesions in the abdomen to go away so that we can eventually go back and do another giant operation where they get a component separation, likely a biologic mesh placement, and then closure. So you're really delaying their return to normalcy by at least 12 months. So it's a big impact.
It's not the same as, say, if you have been able to close their belly. So it does increase their ICU length of stay, their hospital length of stay, their ability to go home, their ability to live outside of some place besides a skilled nursing facility. And it affects the family in a similar way. Financially, it affects them. I think it's very important to try to do whatever you can to get an open abdomen closed down the road, and certainly a lot of the products we use now help that.